All right. Paul Bowman here from Fixing Type 2 Diabetes. So it looks like we are live. So today we're talking about kidney disease prevention and rehab part 2. So yesterday in yesterday's training, and it is recorded, so you can definitely go back and watch it again, or if you missed it. So we covered yesterday uh, the pitfalls of kidney disease and really understanding your numbers so that kidney disease doesn't creep up on you and it's not a surprise, and like it does to many people. So many people don't realize it's a problem till it's way down the road. And in reality, when you understand what we talked about yesterday, you should be able to catch it months and maybe years earlier and really turn it around that much quicker. So if you haven't already, definitely check that out. So as always, I definitely want to know if you're here, whether we're watching this live or recorded, and I definitely want to hear your comments. That said, I'm going to go through everything and then go back to the comments and questions. So if you got comments, got questions, definitely put them in there. And for me, so I know, as well as for the community, and as well as juicing the Facebook algorithm, definitely put your likes, put your comments, so this can get out to more people. So, as I said yesterday, and often with our current legal situation in this country and the way the medical and the legal is, I got to read this disclaimer. So, my cover my butt disclaimer. So, the information expressed in this group is intended to be used for educational purposes only. The author and publisher are not rendering medical advice of any kind, nor is this information to replace medical advice, nor to diagnose, prescribe, or treat any disease, condition, illness, or injury. It is imperative that you, before beginning any nutrition or exercise program, you receive full medical clearance from a licensed healthcare professional. The author and publisher claim no responsibility to any person or entity for any liability, loss, or damage caused allegedly or to be caused directly or indirectly as a result of the use, application, or interpretation of the material in this group. And as I've also been saying, I definitely do say, really mean, consult with your healthcare professionals, but also keep in mind, are they really with their clients, with their patients, with their, however you want to look at that, are they getting the results you're looking for? So definitely consult with them, as well as consult with other professionals that are definitely getting the results you're looking for. And whenever you get diagnosis, whenever you get recommendations from anybody, any professional, to really keep in mind the stuff we're talking about here and take personal responsibility and make the best decisions for yourself. So, getting into what we're talking about today. So, understand now that you understand your numbers and understand those pitfalls and how to avoid them. All right, what do you do with that information? So, I'm going to start with a story about how this whole training got kicked off. Last week, one of my No Excuses Ladies fitness clients asked me, she said, "What should your GFR be?" And I was like, "Well, what is yours?" She said, "62." I was like, "That's not good," especially knowing for her. So that really kind of sparked this whole thing off. So telling the story about her again to relate it to yourself or to your loved ones to make sure that you can avoid these kind of mistakes. So, um, so 62 was her GFR, and so we looked back on her records, and 6 months ago it was 79. 6 months before that, excuse me, 6 months before that it was 80. So then looking at probably some of the most important things, kidneys. The topic of kidneys and kidneys as an organ are rather complex, so you can go deep, deep, deep. It's one you could keep going on. But what are the most important things? I would say are meds and prescription over the counter and supplements done right. So we looked, and so she was on statins and she was on high blood pressure meds, but she's been on those for a long time. That said, um, I would still say those are definitely having an effect on somebody's kidneys and liver and everything else. So, but then we look back, okay, so in the last 6 months, it's really dropped. And so we look back and, all right, she had started taking some vitamin D and B complex. And a lot of people start taking vitamin D or something like that, especially with the whole pandemic and stuff like that. A lot of people have been taking that. So here's definitely a lesson. Um, so in looking at that vitamin D, there were definitely now the vitamin D done itself, that main ingredient, wonderful. Yeah, great for all sorts of good stuff. That said, what are the processing agents? What else is in that capsule? What is it made of? What are the processing agents? What are the fillers? And that was definitely she was guilty, as mindful as she is of her health. She was guilty of, and I don't know what exactly she did, but most people, what do, they just grab something off the shelf, at your local Walmart or your local grocery store or your local pharmacy or your hey, Amazon, what's recommended at Amazon? Okay, let me grab that. And those are often not a good idea. And so it was pretty apparent that that vitamin D really tanked uh, her kidney function. So that said, I would also look at it as most likely the prescription meds, her kidneys were handling them, but they still have an effect. So I would kind of look at it as probably, all right, her kidneys were handling those prescription meds, but then that not so clean vitamin D put her over the edge and really tanked her kidney function. So realizing that that is rather common. Another lesson for that, and not only lesson, hey, look back at your history. Hey, where did my numbers change? What changed then? What changed in my medication? What changed in my supplements? What changed in my diet? What kind of changes happened around the time where you started seeing it decline? And kind of do some investigation there. Another lesson was her when she asked her primary care physician about, okay, my it was 79 6 months ago and now it's 62. Her primary care said, physician said, don't worry about it, which is wrong, wrong, wrong. Um, that said, the lesson is that because of their training or lack of training around certain things, again, doctors can be amazing. Doctors are amazing. Any medical staff is amazing at certain things, and then there's certain things for sometimes obvious reasons, sometimes not so obvious reasons, they're not very good at. And it is very common for medical staff to see something like that where it went from 79 to 62 and I've seen many scenarios like that where they're like, oh, no problem, don't worry about it, when absolutely you should be not necessarily worried about it, but you definitely should be doing something about it. You should be addressing it, proactive, turning that around. So that's another lesson there. So let's continue this conversation. And so if you want to avoid that kind of stuff happening to you, put avoid in the comments. If you're already there and dealing with kidney disease and you want to rehab that, all right, put rehab in there. Um, a very similar thing happened with me. And again, learning the lesson from that. Um, like I said yesterday, 2 years ago, I ended up in the hospital with kidney function in the 50s and all sorts of other problems that I hadn't had before, didn't realize. And so, in investigating in hindsight, yes, I said I look back and, all right, 18 months ago, from there, mine dropped over 18 months. And okay, what was going on? So I would say a big part of mine was also supplements that weren't that clean. And I wasn't really paying attention to what else is in the supplements. I was paying a lot of attention to the main ingredients, the supplements themselves. So I feel pretty confident back then that all the main ingredients for the supplements I was taking were excellent. But in hindsight, in reviewing those with some of my teachers and keeping kidney in mind, realizing that a lot of those supplements, they whether it was what the capsule was made of, uh, processing agents, fillers, stuff like that, that just really are not good for our liver and our kidneys and our health. So I definitely had some of those, which were obviously causing me problems. So what's the lesson? Yeah, definitely big thing towards kidneys is your meds, over-the-counter prescription, and your supplements. So with all of that, my top recommendations for preventing or rehabbing your kidneys would be number one, wisely get off all medications, prescription and over the counter. Some of you might already be thinking it or even saying it out loud. Um, my next part of that is if you think you can't, if you think you shouldn't, I would seriously recommend that you rethink that idea. And if you need to, get the help you need to get off all your meds. And that's, again, prescription, over the counter. Now, that said, 99.9% of the time, if I really looked at somebody's individual case, I would say 99.9% of the time, they absolutely should get off of those. They need to get off of those. Um, but also don't fall into the trap of really thinking that you're that 0.1%. No, most likely you may be thinking that you need those and you're not sure how to get off them, but absolutely should you. I would say stressing wisely get off of those. Don't do some knee jerk reaction and just stop taking your meds. Wisely get off those so that you can really fix whatever problem. And I would say this for about, again, 99.9% of medications. In my experience, all of them, and just some common ones, statins and blood pressure meds and acid reflux meds and painkiller meds, like all of those are, to me, what I understand and what I see, clearly are making things worse for your kidneys as well as a lot of other things. They may be masking a symptom or two, but they are and by masking a symptom or two and not fixing the root problem, they are really making things worse. So wisely get off all your meds. Number two is to run all your supplements through toxinlist.com. And if you're wondering how that's spelled, it is in the post. So look in the post. Toxinlist.com is a great site for reviewing any supplements to see if they are really clean supplements and have a better idea of what are the nasty things that are in supplements that we really want to avoid and keep our kidneys and everything else healthy. Um, and if you're having kidney problems or you're trying to change your kidney function, I would definitely test every 3 months. So a couple things around that. Most people's insurance covers blood tests once a year. But that said, talk to your insurance company, talk to your medical staff, and see what do you qualify for. Depending on what your specific situation is right now, you might qualify for blood tests every 6 months. You might qualify for blood tests every 3 months. Optimally, whether you're paying for them or your insurance company is paying for them, my recommendation is to really, as you're modifying things, to really check your numbers and see if what you think you're doing is really heading you in the right direction. Another thing towards that, talking to a physician's assistant this morning, um, rather than jump through all the hoops that usually takes, meaning sometimes you got to go to the doctor once, get their script for the test, and pay a copay there, and then go get your blood work, and then go back to the doctor and pay another copay, and um, you know that can be definitely like jumping through a lot of hoops sometimes. So if it's something where it is recommended by the doctor to go get your blood work every 3 months or every 6 months or whatever it is, you can set up a regular thing for that. So yeah, ask about that too. Hey, if I'm going to go get my blood work every 3 months on a regular basis for a while or every 6 months for a while, can I set that up so I can just go get my lab work? Um, and another thing too, if for a lot of people, it is easier these days to order their own blood work. So um, there's many sites out there where you can order your own blood work and either pay for it yourself, but now they are also reviewing that a lot of times with a physician. So a lot of times it is covered by your insurance too. So definitely gonna have to do a little bit of work research there, but you can definitely find some good sites where you can order online and a lot of times get covered by your insurance if it's covered by insurance, and then just go down to your local Quest laboratories or your local LabCorp laboratories in your neighborhood and get that done. So it is getting easier to get that stuff done. All right. So seriously, my biggest recommendations for preventing or rehabbing your kidney issues are the biggest ones by far would be get off any meds, prescription, over the counter, and run any supplements through toxinlist.com and test to assess if you're going in the right direction. All right. And so, as I said yesterday, if you're engaging this, I just I want to know you're here, and I want to know how you're doing. So for everyone that's engaged in this kidney training, if he hasn't already, Drake Pearson's gonna reach out by messenger, check in, see where you are, exactly where you are with your diabetes, with your kidneys, with your health, so we have a good idea where you are, and to see if we can help you, and if we can help you, to see how. So if you haven't already, accept his friend request, look for his message, check your message requests, and as always, if you got any questions, put them in the comments. I will get back to those as soon as I can. Have a great day.